What is the number one worldwide cause of death? Heart disease. What can we do about it? What can be done to help us not be part of the statistics? One thing is potassium. What effect does that have on high blood pressure? Well, basically, if you have enough potassium, it does help regulate blood pressure and keep it in a healthy range compared to those with potassium poor diets. Also, it basically helps with the normal functioning of all cells. It actually regulates the heartbeat. It helps with muscles and nerves, and one of those muscles is your heart. It's vital for synthesizing protein and metabolizing the carbohydrates. So obviously it's very important. So what do you think of for potassium? How much do you think you need per day? I had no idea. 4,700 milligrams per day. So I have a supplement that I take, but I also try to get a lot of it in my food. And that could be bananas. That's what I always think of, right, for potassium. But there's a lot of other ones. I mean, fish like salmon, beans, spinach. There's lots of good sources of vegetables and fruit that are rich in potassium. Sweet potatoes, cantaloupe, avocados. And this can all help lower your risk of stroke and help stabilize your blood pressure. So definitely an important mineral to keep in check. So, and a lot of this information got from a nutritionist as well as a Harvard study that was done. And basically looking at potassium and, stroke risk as far as blood pressure and other impacts. So definitely want to try to eat some produce, fruits, vegetables, as I mentioned. And one caution is when you're looking at items to include is what are you taking? Are you taking anything that's possibly raising your potassium, a medication, or one that's lowering it? So for instance, if you're taking any ACE inhibitors, those may raise the levels of potassium. So can ibuprofen, like Advil or Motrin, Aleve. That can increase your potassium levels. So be careful when you're taking those kind of medications. Then a diuretic can actually lower your potassium, so you're going to want to increase your intake. Try to get most of it from food. I have some natural supplements that I use, but also I try to get quite a bit of my potassium through food. One caution on that is salt substitutes. So if you're taking or using a salt substitute, trying to watch your sodium, obviously, then those can contain a very high amount of potassium. Some of them as much as 800 milligrams of potassium. So just be very careful if you try to do that combining with your food that you don't overdo it with the potassium, because that can also have adverse effects. So let's talk more as far as healthy and getting rid of that number one killer. Get rid of that number one killer. And subscribe to the channel. Thanks. Diana Decker, Natural Living Explorer.